U.S. health officials say nearly 800,000 doses of the monkeypox vaccine will soon be available for distribution. There are now nearly 3,600 confirmed cases in 46 states. The U.S. has already sent more than 310,000 doses of the vaccine to state and local officials, but clinics in major cities such as San Francisco and New York still don't have enough shots to meet the demand. For more on this, I am joined by Dr. Leo Nissola. He is the Chief Scientific Officer of First Bio Research. Dr. Nissola, welcome back to the program. Can you quickly remind our viewers how monkeypox is transmitted and some of the symptoms?
Good to see you. Safe human interaction is rare and rare these days. Monkeypox is mostly spread through skin-to-skin contact. That is, direct contact with a sore, with a wound, with a pustule, with a skin rash. But it also can be spread through bodily fluids, in exchanges of bodily fluids like urine, blood, semen, and even saliva. Although a little bit more rare on the rare side, prolonged face-to-face interactions can also lead to an infection.
Well, after weeks of delays, as I mentioned, 800,000 more doses of the vaccine are expected to arrive in the U.S., but there is insufficient supply in cities like San Francisco and New York. Will this be enough to meet that demand?
I think it's certainly good news. 800,000 vials will do a tremendous amount of good right now, especially for the communities that have been mostly affected by this particular virus. But however, remember, this vaccine is 85% efficacious, so it's a good vaccine, but it requires 2 doses, 4 weeks apart. So we will need definitely more vaccines to put an end to this problem.
Well, there are now cases of children in the U.S. contracting monkeypox. Do we know more about how they were infected or how this virus affects younger patients?
So typically, in my experience, working in the outskirts of South America in tropical hospitals with children, we saw cases with children being a little bit more difficult to manage than in healthy adults. That said, the number of cases of monkeypox in the United States today predominantly are not in children. They are predominantly in male adults. So at this time, it is, as I mentioned in the beginning of our conversation, helpful to be extra cautious.
All right. Dr. Leo Nissola, thank you so much for joining us, and thank you, as always, for all that you do.
Thanks for having me.